And we are recording. Hi, everyone. This is going to be our IBHS progress note video, which you will use with me. We have Kathleen Sammer and Mike Jordan. And what we'll do in this video is go through the mobile therapy IBHS progress note and then a behavior consultant IBHS progress note. And I will share my screen and we will just jump right into it. So I'm going to minimize that to whoever is talking. And here we have Elmer, and you can see up at the top bar, it's his enrollment under the IBHS program. For adding an event looks a little bit different than under BHRS. Actually, the progress note that you select will be determined by your role with the client. So let's start with a mobile therapy note, which is down here. And then after we do that, we'll provide examples with the behavior consultant note. So I'm going to click MT. And you'll see how similar the note really is to the BHRS progress note. I personally think that it's better, but for the session information is almost identical to what you're used to. The start time and end time is here. The cancellation top section is now different, whereas it used to be under type of contact. It's actually separated, which is great. So for a cancellation session, what you would do is click this. Attempts to contact would be this way. But then we still want you to write the remarks. If you can just go down to the assessment section and explain kind of why the session was canceled. So for this, let's pretend that we had a session yesterday from 4 p.m. until 30 p.m. And this location box is where you'll put the county. And we're going to hold off on providing any details into this setting box. We're actually working with IT, who's working with our fiscal department for down the road once we move IBHS into billing and evolve. This might have a billing aspect to it, so future information will be submitted about that. For now, this can just be left blank. So we'll say that there was a face-to-face session and the client and the parent was present, and this is our data section. It looks different in the sense that this grid here is where we're going to be able to actually input numerical data, which you'll select your goal, input your numerical data, and then you also have the freedom to elaborate on the data related to the session in our data narrative box. So I'll kind of let Mike rock out here. We'll do an example for this MT note for both of Elmer's goals. So the first goal is Elmer will increase his ability to engage in coping skills by 50% in the absence of eloping from the instructional area for a period of 6 months. So utilization of coping skills and ability to not elope. This behavior is really what you can do, and we can speak a little bit to this as well. The behavior that you're collecting data on is your target behavior, but you can also input your data related to the replacement behavior as well. So for this example, let's start with the target behavior, which is reduced elopement behaviors, running out of the room, slamming the door, screaming, leaving the place, refusing to return to the instructional area. And then we have it kind of split between severe, moderate, and mild target behaviors. As far as the example of how long we want to say that the client was engaging in these target behaviors, Kathleen and Mike, do you want to kind of pop in?
I think that, so the idea behind having separate drop down boxes was if there is one instance, that is the duration. So say this kiddo is involved in this behavior for 15 minutes, our first duration is 15 minutes. Latency may or may not apply, it depends on the goal. And then intensity, you can go right back over to the goal section and rate it as a 1, a 2, or a 3. Or I don't know if we are listing them as 1, 2s, and 3s, or mild, moderate, severe? I haven't pulled down that box yet.
Intensity is mild, moderate, severe.
Okay, so then you're able, right, so you're able to categorize it as mild, moderate, and severe. So duration, we can say it's 15 minutes.
Okay.
And then we can take a peek back at the goal and see if that 15 minutes is part of the criteria for the intensity.
It's moderate then.
Moderate, right. So you just put an M in that one. And then Mike, you can speak to the data narrative piece for the MT side.
And I just wanted to say, you know, as you're doing this and as you're putting the information in the note, this will make it easier for people to see the importance that we're placing on the way we're writing the treatment plans now. Even just to be able to break down what severe, mild, moderate, and mild looks like on the treatment plan, and having that fully defined then allows you to be able to write a really good note that then captures that data based on, you know, based off the plan. So I mean, that's kind of how everything should be flowing. That if you're struggling to write a note, there might be a reason that based on the plan might need something that needs revision or needs tweaking because it doesn't, you know, operationally define what you're looking to put in the note. And so I think, you know, when the plan is written well and those severe behaviors, moderate behaviors, mild target behaviors are clearly defined, it's going to make writing the note a lot easier. So I was just thinking about that as I was watching this and thinking, yeah, I could see someone struggling with this if the plan wasn't laid out the way we're looking for it to be laid out. That being said, so once you have your goal and your behavior, your duration, your latency, intensity, all of that, you'll do that again, as Jen said, and Kathleen said, for each instance that the behavior has occurred, and you'll sort of, that'll be your data section for how we're going to be able to measure and track the duration, latency, intensity, things like that. The big difference is, and that'll be similar for the BSC note, the MT note, those will be similar. Where you're going to have differences is going to be once you've compiled that data and you want to speak on it. And we have a data narrative section on the note. Jen's just clicking away here, so now
And as you're talking, Mike, sorry, so this is the same goal that we're putting here 3 different times, but over in the behavior, I'll say that we're also tracking the replacement behavior as well. So say that after these 15-minute and 8-minute durations of target behavior, we can also show maybe that there was an instance of the positive behavior to include as well in the data tracking section.
So then once you have entered all of that data in, let's assume you've got it all put together. You're going to have the data box that you're going to want to speak on that data. And this is where I think it'll look different from what role you're doing the note for, whether it's MT work or BC work. The data section for MT work is going to focus a lot more on the emotional aspects of what's happening in the session. So from a behavior standpoint, it might be, you know, if the elopement is what you're working on reducing, it might be much more about the system, the behavior plan that's being put in place to decrease that eloping behavior. From an MT perspective, it's going to be about what is happening for that child emotionally that's causing that elopement behavior to happen. So what was the child feeling before that happened? What was the child feeling, you know, right after that happened, processing with them, how they can then utilize those coping skills to decrease, you know, the event of elopement by, let's say they're eloping because they're angry at their mother or father. the MT's focus might be on how can we help you process your feelings in a more productive way that doesn't involve the eloping. And so while the data above, that table is going to be very similar, the data narrative is going to be different based on the roles. And even with the goals, like let's say you're working with a client who is like a pure MT kind of client, like it's only anxiety as the presenting problem. That might look vastly different because there might not be instances of panic attacks in a session or anxiety in a session. So your note might be a lot less focused on the table and more focused on the narrative box in the description of that person's anxiety.
Mike, quick question. Can I
Sure.
ask you? So, and this came up for a couple people who are doing both roles right now. If they're doing MT work, but either the client or the parent reported like 4 panic attacks that week and had like duration for you, do you want that written in the data box, like according to parent report, or do you want it also captured in the data table and then you label that the data above represents, parent reported data from this week? How do you want it?
Totally knew you were going to ask that question because I was
Sorry.
As I was describing it, I was thinking
It's a question that's been brought up too, so I just want to make sure we give them the same answer.
Well, I'm going to ask a question with a question. So if you were doing a behavioral note, would you be reporting things that happened during the week or only things that happen in the session?
Only things that happen in the session, but we have separate data that the parents are collecting for us all week long that we then include in the data analysis.
But do you include it in the note though?
Not that note. But it does get lumped into the monthly data collection.
Yeah, I would think we wouldn't want to include it in the note. We would want to include it in the data section, but that's...
Okay. I just want them to be consistent.
Because they're going on client report to put in data. So then you'd be relying on the client to know specifically how many, or the family to know specifically how many, let's say, panic attacks happened, how long the duration was, how long the latency was, all that stuff. But if you're in the session and it's happening, then you can you visually see it and be able to report out on it. So that's why I say, if it was a situation like that where you're dealing with something like anxiety or depression, you're going to have very little, hopefully, unless your client's having a lot of panic attacks during session.
Right.
You're going to have a lot less data, more likely than not, than you would for a BC note. Just kind of the nature of that. Now, this was a good example because this one with Elmer is one where you could go either way. I mean, elopement can certainly have its behavior aspects, but then there can also be the emotional stuff you could work on. But I think if it was like strictly, client suppressed, you might have a lot less data in that section.
Okay.
I have a question. For replacement behavior, and Kathleen, the way that it was like defined in the plan doesn't have
an intensity measure. I think that's going to be driven by the clinician and when they write it.
Okay.
I do. I think it's harder for them to definitely define that. It's not impossible, but it takes more. And I think our big goal was to make sure we had mild, moderate, and severe for the targets. And I feel like we could potentially tackle replacement, mild, moderate, and severe, like next time we decide to do revisions if we need to. I mean, they can include them now.
Well, I'm even thinking when you're talking about something positive and like utilizing coping skills, like it's almost like the intensity measure wouldn't be included.
It's harder. It is. Okay. It's harder. Same. And
so for this, would that be left blank?
Yes. Okay. And so the goal column has to be checked off, right? The behavior column has to be checked off. Okay. The rest of them don't necessarily have to be checked off for MT note, right, Mike? Like those are potentially not going to apply for an MT note.
Totally right? Question. Sorry.
So the goal and the behavior have to be checked off for an MT note, but the duration, latency, intensity may or may not be checked off for an MT note. Right. Okay.
Yes.
Okay.
So that spiel was just basically inclusive of the MT spin on a more behaviorally driven goal. Elmer also has his second goal, which is to increase his attention and time on task by 50% in the absence of engaging in protest behaviors for a period of 6 months. Was this our behavioral goal, or was this one our behavioral goal?
This one was our behavioral goal. The other one was our MT goal.
Okay.
But they were both written by a behaviorist, which is why I said all over this. Guys, we should have had an
Which
MT
is,
do this one.
we looped Mike in because he's very therapeutic. So, okay, the second goal here we'll select is increasing his attention and time on task in the absence of engaging in protest behaviors.
And so this is where we would probably end up with multiple drop-down boxes. So if we have a kiddo who has an issue with time on task, right, and we have a 2-hour session, we're probably going to get 5 to 20 drop-downs. We're gonna get a lot of data on this kiddo if we're working on that. So we would click on his goal. And Jen, can you do the target before you do the replacement?
Yes.
Okay, so according to Elmer already, he's around 25 in a session, which is, it's hefty. That's, 12 or 13 times where he's not paying attention per session. So duration, let me read him really quick. So he's averaging, his middle of the road is about 15 minutes, 8 to 15 minutes. So we're gonna click a bunch of them that are 8 minutes, 9 minutes, 12 minutes. We're gonna get a whole bunch of those. I'm gonna skip latency for now on him. I'll do latency in a little bit. Intensity, we can click a whole bunch of moderates just to make life simple. And then our data section is gonna look, our data narrative box is gonna look very different because we're working with a kiddo who is slamming doors and throwing things and screaming at us and refusing to attend to anything that we're doing. So instead of the data section having really a discussion of feelings, it's probably going to be a little bit more descriptive related to the behavior. So for the BC section, it's probably going to say something like a total number of times that he was not paying attention. So it could be 15 because that seems to be reasonable for Elmer. So we want to make sure we're talking about the actual number, but also if there's any kind of progress through the session. So was Elmer just literally not paying attention for the entire session, or was an intervention that we applied something that turned that behavior around? So this is really different from the MT note because we're talking about the actual intervention that we used. So say we used a token economy for him. And I'd have to go back and look at his interventions to tell you what we wrote in here, but say we used some kind of visual timer, a token economy, and a choice board. We would then say which one of them seemed to work better based on his performance. We could then talk about when we got him to engage in the replacement behavior based on whichever of those interventions seemed to be most successful. And in this part, because our delivery of service is much more about skills generalization, I include what the parent or caregiver is doing at that time. So I am explaining, I modeled this, and then the parent did this action. So I modeled how to use the choice board, and then the parent used the choice board. It was successful, and here's why it was successful. And then feedback was provided to the parent if it wasn't successful about what they needed to do differently. So we're taking apart that intervention, but we're connecting it always to what the parent or caregiver did with us, because ours is less about that sort of therapeutic delivery of like the clinical work and more about the behavior work. And we can't do the behavior work unless we're generalizing to the parent, and I want to know how we're doing that. That has to be in there because we need to see how the parent is doing with the intervention skill acquisition too. Sorry, that was a lot, Jen. Does that all make sense?
Right. So let's just, I was actually thinking it might just make sense for us to just continue going this route where we're picking both goals and talking about
About how
MT
they
and
would be
DSC
different.
instead of exampling, because we were going to originally show an MT note, show a BSC note. I'm okay if you guys are, if we just continue to do it this way.
I think the other thing that's helpful is there's a million training session opportunities, and this
Right.
is not going to be a really long, tedious video. So this kind
Right.
of gives the, here's what we're generally expecting, and then they can ask those
Right.
questions in the training video, and they can email too.
Mike, with the goal of an example such as like increasing attention and not engaging in protest behaviors, is there anything that you want to add for how an MT would spin such a note like that? I mean, such a behavior in the note?
Sure. So something might, so I'm going to give an example of something they might write. So they might write, you know, during session, client Elmer's concentration wandered several times as evidenced by, you know, inattentiveness to clinician's questions. This clinician asked Elmer what he was thinking during those times, and if he could talk more about what would help him to focus on the session more, what he was thinking, what he was feeling. Again, that would be a lot of the focus for an MT work. I know it breaks it down to the most basic, but I really think that's kind of where it all is. The data section is going to be, I was thinking this when Kathleen talked about how, so for the BC note, it's descriptive of the behavior. For the MT note, it's still going to be descriptive, but it's going to be descriptive about what was talked about. So oftentimes when I would write a note, data section would say, you know, client and therapist talked about this, client and therapist discussed this. And it was more about what they were talking about. So even for the previous goal, it was about elopement. So it might be therapist asked client about, you know, what he was feeling during the elopement process, you know, while he was running away. Client reported that when his mother and father fight, he gets really upset and feels the need to escape from that situation. Therapist and client then discussed other ways that client could potentially work through his emotions without running away from the situation. And so those are instances where you're talking about, you're still talking about what happened in the session. You're still describing what happened, but you're not describing the behavior as much as you're describing the dialogue. You're describing the content of what was discussed and the reasoning for it. So that's, I think, another way to differentiate between the MT note and the BC note.
And Jen, that same scenario from like the BC side would be something along the lines of like behavior analyst reviewed the 3-term contingency, which was parents fighting, kid eloping, and then what happened after the kiddo eloped. So it's the same exact information in terms of what happened.
Reviewed
so reviewed the 3-term contingency, so antecedent, behavior, consequence, right? That's what we're looking for. We would like to be able to track what happened before the behavior, what was the behavior, and what was the maintaining after event, right? And so if this kiddo, every time his parents are fighting, decides he's going to elope, and then after the elopement, they take him out for ice cream might be maintaining elopement, right? And so if we think about how do we change that contingency, how do we instead talk to him about earning ice cream for using other coping skills as set forth by the MT, but we've put the behavior like contingency in place and changed the end of that. So they go hand in hand, right? And it's the same case, the same information, but we're attacking it from both sides. That's how that would look different, even for the same incident. Does that make sense?
Yeah. So I think that this is helpful to allow for the different roles to kind of get that quick view. And like Kathleen already said, as you guys are watching this, it's incredibly encouraged to sign up for one of those Sign Up Genius Zoom meetings, ask any questions for anyone watching this down the line, as this is going to be utilized in like onboarding in the far future, asking for clarification by your lead clinician or supervisor or any AD if you do have questions. We're kind of just doing the best we can now. Okay, let's do the same thing for MT and BSc like we just did for the data section, but in the assessment. So Mike, why don't you go first?
So an assessment section for MT work. The easiest way I break down a note is usually the data section is what happened in the session. The assessment section is the therapist's perception of what is going on. So a lot of times in my assessment sections, I'll use words like seems or may need or things that are my own ideas of where the work needs to go. So for this example, I might write something like, client seems to be struggling with the communication difficulties that his parents are experiencing and looking to escape from that family dynamic by leaving the area. Client may need to learn to channel his feelings into alternative outlets and develop those coping skills such as journaling about his feelings, drawing about his feelings, talking through his feelings in session, something like that. But again, the assessment section is here's what I think as the therapist is happening and what I think would be beneficial for moving forward with the client and what they could do to work through some of that emotional stuff that's happening.
Perfect. Thank you. Kathleen, you're next.
So assessment for the BC section, it's not going to sound dramatically different from Mike, except for that we're going to try to perceive a function. And I say perceive because we can't label a function unless we've done functional analysis for certain. We can only correlate. So we would always use the word, the perceived function. So, and that's important in our writing.
Can you say that in like maybe non-ABA language? Because I'm not sure how. Yep. Okay, go ahead.
Okay. So Mike did say, like, what does the client want to do? He wants to escape, right? Because he finds his parents fighting or arguing unpleasant, right? So what we want to do is make sure we're labeling function, right? And I can do a whole nother video on function if we need to. But what he's trying to do really is escape the situation because he finds it aversive, right? The secondary piece of this, if we're going for the BC part, is that it's maintained. I think I said he was getting ice cream afterwards. So it's maintained by access to edibles, right? So then we would say something along the lines of, perceived primary function is escape with a secondary maintained consequence of access to tangibles, right? So it's access to something edible, tangible. And I'll translate all of that in another training if you'd like me to. But it's basically, I'm getting something following the behavior and that something is pleasant to me.
So I'm going to try and just like, because thinking from a non-ABA standpoint, something that you could write in this section is therapist feels that maybe by escaping the room and shutting down, he receives increased parent attention, and that may often result in a treat, you're saying, which is maybe the function of that behavior.
Do me a favor and change feels to observe.
I swear to God, I'm so glad you said that. I was totally going to be like, that's not a feeling when you really need to change the word feels.
Oh my gosh. Okay.
Sorry.
I was going to say it 2 seconds later if you did, and I was going to say, wait, that's not a feeling. We need to say like thinks or believes.
So,
We can't say feels because that's not a feeling.
okay. All right. So he received increased parent attention, and often this results in some sort of tangible or edible treat. He gets something, right?
Maybe that was wrong. Worst part
Just
about
I.
this is my spelling
go.
issues.
Okay. Behavior consultant would review. I don't want to say the 3-term contingency because I'm just going to confuse people, but behavior consultant would review the sequence of events and work with the family to rearrange. I would write environmental contingencies, but we'll say the order of events and how Elmer is able to earn access to, did we call them treats? What did we call them? Edible or tangible treats for utilizing coping skills as designed by the MT. So like what we're saying is, here's your function, here's what's keeping it going. How are we going to fix it? We're going to change the order. So listen, Elmer, if next time mom and dad fight, you're able to use drawing or deep breathing, and I forget what else Mike mentioned, any of the things Mike mentioned, instead of eloping, then when all of this is done, we can still go and have this ice cream together. It changes your environmental contingencies to bring that behavior down.
And for anyone who maybe feels a little bit confused by that, I think that really also a behavior consultant notes assessment section can look very similar to the way that Mike sort of described his. Is that correct? Or?
You guys supervise the behavior consultants and I don't, so I don't want to answer that. If they're moving towards the ABA side, no. Like I want to train them on that part, but if they're not and ABA is not appropriate, then.
Is Mike here?
Yes, Mike's thinking.
I just think that the MT note is going to, I mean, you're not going to, the BC note on the assessment part is not going to usually talk about
Feelings,
yeah. And even thoughts. I mean, I think or as much perception. It's going to be the BC note is going to be more concrete, even in the assessment section, I think. And the MT note is going to be much more geared toward the perception of what's going on related to the emotional aspects. And the BC note is going to be the perception of what's happening in the session from a behavioral standpoint. So these are the behaviors that are happening. These are why they're happening. And this is what I think we can do to decrease the behavior. But the assessment piece for the MT is going to be, I keep going back to the anxiety example because I'm thinking of like a pure
MT case.
Emotional, issue that somebody's dealing with. So an assessment section on that might look like, client seems to be struggling emotionally with current changes in life, and seems to have a lot of negative thoughts that are interfering with the functioning day to day. Client may need to implement deep breathing techniques, take walks when needed, exercise, journal, to help to develop coping skills that will help him to decrease the anxiety he's experiencing when confronted with those situations. And that was a little winded, but something to that effect, because you're talking about the feeling aspects and the feelings that are associated with what's happening. Obviously there are behaviors in there. I mean, the things that they're going to implement are behavioral in terms of the things that they're going to do to cope potentially, but you're still not talking about, function of behavior. You're not talking about, you know, the
Like antecedent
reports or things
analysis
like that.
or
You're just,
maintain
yeah,
consequences and that kind of thing.
you're just focusing on
The
what the client's
emotional
thinking
side.
and feeling about that situation and how they can then reshape that in um, whatever way that looks like.
Got it.
And just for the BC side too, so the line that says expressing your own views on the client's behavior. So we're really taking our observable data and reported data and analyzing to come up with function, and looking at that before, during, and after piece, to try to figure out what's driving it.
That was helpful.
The other thing you would put in the assessment section from an MT standpoint, and Kathleen can speak more if you would put it there on the BC sides, I don't know. But from an MT perspective, if I was writing this note and I was coming up against resistance, I would definitely want to document that in this section. So clients seemed resistant to wanting to talk about their feelings. Clients seemed really very guarded when asked about his mother and father's relationship and how he feels about that. Client shut down emotionally. You know, anything that was happening that was related to, now some of that would be in the data section about what they did. So again, the actual shutting down would probably be in your data section. You know, client shut down emotionally during session and refused to talk. But then the assessment piece, it would be, you know, clients seemed very guarded and very resistant to talking about parents relationship. Clients seemed noticeably upset when prompted to answer about that. Therapists may need to go with clients' resistance related to the difficulty talking about the situation and help client to get to a place where they are able to open up about that. Something like that.
Great. That sounds good.
We would probably speak to that in much more in the parent sense and how they deliver an intervention. And I'll keep it short and sweet, but you know, lack of parent engagement or lack of consistent use of interventions appears to be impacting, you know, forward progress on goal such and such. Like we might do something like that. We wouldn't necessarily label client and interaction in talking about things like this, because that's like not our job. So like that's Mike's. And appropriately so.
Anything else you want to add? Anything that while we were working on this section you feel like would help if we also put in this section? Because I'll save this treatment plan and this can be used as like a guide and example sent out to everyone. So
one quick note, Jen,
Okay.
we still have a barriers section down here, do we?
Correct.
So I remember that. I think for barriers, people get really hung up, and it's something that I just always like to say, barriers can be either observed barriers in that session, and if you feel like you've got none, like none were noted, I always say to everyone that I'm working with, you know, you can say, you know, no barriers noted during this treatment. However, ongoing barriers may be, you know, financial insecurity or food insecurity or parental mental health or what have you, just because it might be something that seems to carry through your treatment.
Yeah, and the thing I would say about the barriers section is that there is often an idea that this is a negative or that there is judgment in this section, that if we're putting what barriers are, that is that we're
less supportive of a family.
Yeah, that we're saying that there's something that they're doing wrong that are causing these barriers. And really it's not about that. It's about just stating factually what is causing a barrier in the treatment. It's not intended to have judgment or
Right.
any kind of negative connotation to it.
Sometimes it's just something to be identified so that we can find more supports for it too.
Right.
And then for transfer of skills, at least from the...
Let's do this first. I mean,
Okay,
anything
go ahead,
you
I'm
guys
sorry.
want to add about these 7 sections?
Just that they have to be completed. I know a lot of people have not always completed them. They need to
Correct.
be completed from session to session.
Great. Let's see. No.
And then for transfer skills, at least from the BC side, that is that piece about what are you physically teaching the family. So you modeled how to use a task analysis, or you modeled verbal behavior techniques within the natural environment, or you modeled an if-then consequence board that you created. But it is literally what you are teaching the family skill-wise in that session for the BC and ABA side.
Is that similar, but maybe
Probably
slightly
not.
different?
I actually think it would be, no, I actually think it would be very similar for the
Okay,
MP side. It would just be what you're teaching the client in terms of coping skills. So, you know, teaching deep breathing exercises, you know, teaching meditation and exercises, modeling expression of feelings. I always joke, I used to run anger management for years, and I would come into anger management after having driven on 76 for like an hour, and I would come in like freaking out. And so I was modeling how you can express your anger without getting in trouble for it. And so I think there are similar, I think that section is fairly similar in terms of what you're looking to do, which is to talk about what it is that you provided to the client or the family that gives them
greater
a
skills
tool to use to be able to cope with whatever's going on.
So for just popping back up to here, if there was a barrier to treatment, you obviously want to include that. But I'll say if no barrier was noted, you can say no barriers noted.
Mm-hmm.
But some often barriers to treatment, like Mike described and Kathleen described, obviously eloping, like the actual behavior sometimes is a barrier to having a successful therapeutic session.
Even things like, you know, if you're working with a kiddo whose verbal ability is not yet developed, you know, and they're 5, an ongoing barrier would be, you know, so-and-so's inability to communicate with age-appropriate peers while at the playground. You know, he's not able to go up and say, hey, let's play tag, right? That's a barrier to social skills development, if that's a goal.
Right.
So those are ongoing things that can follow session to session.
Okay. Can either of you provide an example of a barrier to treatment that is maybe not where you would put here continued barriers to progress are, like that communication barrier would be one that maybe would be included here, but a specific to the actual session?
Like to that day?
Correct. Like that hour and a half that we were with Elmer, like what could you put here?
Sure. Elmer is currently experiencing a medication change and has fallen asleep in the middle of the session, or has begun pacing rapidly and crashing into the wall. You know, those are barriers. Parent came home today and reported job loss. Your session just got hijacked. It's a barrier to treatment that day.
Like for even a BC that is attending the session at school, say that there's a substitute teacher, you can maybe note that clients.
Sure, because they're not familiar with the plan.
Correct.
So absolutely. or maybe it was that their one-on-one was absent or the RBT was ill. Like those are all everyday barriers that cause us to pause. Yes, all of it.
And if you want to speak a little bit to this section where you now have the opportunity to upload 3 various documents, maybe more for that office related note, or from an MT perspective, say that one of the coping skills that Mike explained was drawing feelings. You can snag a picture of that and upload it into the note. Like that would be highly encouraged as well.
For the BC side, it would be if you developed a task analysis, if you developed verbal behavior programming, and you've got data sheet development. If you've done data collection and analysis, your graphs would get uploaded here. Anything that you have created or invented yourself would be uploaded here.
Great. And then we'll just say home. And of course, this section, like, and Kathleen and Mike, you can talk a little bit more about this. This is just projected, like what you're assuming that next session will look like. But like the MCOs that stayed are never going to look at the next note and compare it to your plan in the previous.
You said mom was going to be there.
Right. But just who you expect would be there. This section, would you prefer them to be specific, or how do you instruct your staff to write out?
I just put, if you're going to work on an identified goal, what the goal number is. If you're going to be doing office work because you're developing an intervention, then that's what you're writing in there. I don't need a narrative there.
Also, we didn't talk about this earlier, but I think it's important to note there will be times, inevitably, where the session doesn't follow the format necessarily of what you are looking to work on. So again, I'll just go from the MT side. Let's say you're working on anxiety, and that's the goal. That's the main goal. And everything's related to anxiety. And the client comes in crying to the session. And the whole session is about sadness and depression symptoms. I think it's important to note that in that data section or above that there was a diversion from the treatment plan goals for this particular session. Here's why that happened. And then, so I thought of that in the goal section because I think you'd want to say, we will look to move back to addressing, identified goals. However, if what happened in today's session continued to be a pattern, we will look to
review the plan,
update and review the treatment plan, and change the goals to address these new concerns, something like that. So I think it'd be important to note this in your note that there was that divergence, and that you're going to look to reevaluate the need for an update or a review if that continued.
I think that it's really great that you just said that. When in doubt, just kind of, I feel like a good tip is just be transparent in your note. Like you said, it's not like if there is not a sadness or depression goal right now, but the whole goal was related to that, would you suggest that they select the closest goal, or maybe like how would you provide input in assessing this section?
I mean, I think that's fair. We've had sessions that I think have been much less of what we planned due to COVID-19 for a while. It was definitely you had to just join the family and, you know, focus on the fact that COVID-19 had happened and the pandemic was here. And our notes were definitely not what we would normally work on. And we had to say, you know, due to COVID-19, the family is processing all of the changes that are happening. And we did not address goal 1 as planned because the child was not able to attend to this today. Like, and I think that that's fair. And I think it also, as Mike said, it allows you to sort of say, how many times did I have to say that? Now do I need to change the plan?
Right.
Yeah. So again, so yeah, to Jen's point, you would still choose, you still need to choose a goal,
that
but you
is
can,
related.
but you can explain why that's completely not, wasn't addressed
What you
in
did.
the data narrative, which is why that data narrative is so important to have.
Yeah.
To be able to explain that, especially like we've said in these times where they're not going according to plan and you have to pivot.
Perfect.
I think the only other box is the collaboration box. And I think that's one of those boxes that if you plan on collaborating with somebody, you can put in who they are and that you're aiming to do it within the week and your general topic, whatever it's about. And if you're not, it's kind of an NA.
The signature section, we would have you sign your note and then timestamp it. I don't need to get too much into this now. It is more of a billing piece, which we are heading that way. But I want this video to focus more on your comfortability in creating content. So still practice your provider signature. You can capture it here. We still want you, oh goodness, writing your note, writing your signature, and then you can still timestamp it there. But no need to worry about this just yet. Anything else that, and as always, you can also ignore this last section too, and this section. Anything else that you guys want to add? So just in case there's any confusion, when Kathleen, Mike, and I, before recording in creating this video, we thought that it would be fine to do an MT note and a BC note and input both, but I think that the way that we explained this is actually more beneficial, especially there are people that carry both roles within the program to be able to decipher the differences all on one plan. So I'm actually happy about the way that went. Even though we selected MT at the beginning, this will just be used for both roles at this point. Okay, so I'm going to save this. This is a new feature in Evolve. Just press cancel. It still saves. The cancel can be scary, but it's okay if you just press cancel. Your note is still in there.
I was just going to say there'll be habitual checking for like a month.
I know. Your note is saved and it is in here. It is beautiful. No need to worry about that. I'm going to stop sharing and it will bring us back. Any last remarks?
Good.
All righty. Thank you, guys.
Thanks.
Thank you.